I started Piedmont Eye Center in 1995. I was the third partner to join. We now have 8. When I joined, I was doing pretty much everything from pediatric ophthalmology and surgery to glaucoma and of course some refractive surgery. Since then, I have kind of specialized in just cataract and refractive surgery. So I do LASIK now, I no longer do radiokeratotomy. When patients ask me about LASIK and I haven't seen them yet, what I tell them is it really requires a detailed, thorough, dilated eye exam with all the measurements of the cornea that we need to know about. And make sure it's with someone who's experienced in doing the procedure. When a patient is ready to have surgery, it's the day of surgery, it's normal for them to be a little apprehensive. So I spend a few minutes just kind of going basically over what's involved. So I tell them they're going to go back. We give them numbing drops to help make things comfortable for their eyes as we're working around that area. And they're lying flat, comfortably on their back. They're between 2 lasers that we use. So we'll cover one eye because we do one eye at a time. And the first laser basically comes down and kind of helps hold the eye, so the person doesn't have to worry about moving. That's one of the biggest fears, is what if I move? Well, that laser has a way of kind of holding the eye in place. So the patient will feel a little pressure from that, but it's not painful. And that way they don't have to worry about that. They also don't have to worry about blinking. So that alone is helpful to them to know that, okay, I don't have to worry about blinking or moving. The laser and everything's taking care of that. When the flap is done, then they're moved over to the laser that does the actual treatment. And that's very easy for them because they're just looking up at some lights. And there they don't have to worry about moving because it has tracking software. So it's really kind of neat to have that technology. A lot of people are concerned about the cost of LASIK. One of the things that kind of drives the cost up is the cost of the equipment and the cost of keeping current with the updates and upgrades and so forth. Having said that, we do everything we can to make it as affordable as possible. There are payment plans and financing options. And so our team is used to kind of working through that situation to make very affordable payments for LASIK. LASIK is not for everybody. If someone's happy with wearing glasses or wearing contacts, then that's a good option. But for someone who wants to try to see better, not be as dependent upon glasses or contacts, LASIK is a great option. So it's a great procedure and it's a very safe procedure.